Right now, children's hospitals across the country are seeing a big uptick in young children sick with respiratory viruses, especially the highly contagious RSV.
It can cause severe breathing problems for babies, and hospitals here in our area are also seeing an increase in patients.
WPTV News Channel 5's Stephanie Susskind has more on the symptoms to look out for and when it may be time to head to the hospital.
Here at Palms West Hospital, the PICU, Pediatric Intensive Care Unit, is seeing a record number of patients with RSV for this time of year, and doctors worry what that means for the rest of the winter season.
The whole experience was really eye-opening for us.
Sebastian Clark is thankful baby Ivy is back to her smiling self after a bout with RSV that landed her in the hospital.
She was starting to that sort of coughing where you just kind of know that it's deep in the chest, and you can sort of see, as our pediatrician pointed out, the rib cage is really sort of compressing in and out, and was really getting close to struggling to catch a breath between coughing fits. And it was, obviously very, very scary.
The respiratory virus is surging across the country to levels usually reserved for December and January.
Runny nose, maybe some irritability, difficulty taking formula or milk.
Dr. Young-Sing De Silva is the pediatric medical director at Palms West Hospital. He says most children will handle the virus just fine, but some, especially infants, could see worsening symptoms that lead to a hospital visit.
Really, day 3 to 5 are the days where you need to have increased vigilance and really watch for those signs of increased work of breathing, or any kind of color change, of course, would be an emergency situation.
He says this early peak could be because of kids' limited exposure to viruses during the pandemic.
We, shudder to think at what the rest of the winter is going to bring. Of course, the flu certainly has not peaked yet, and we're all kind of waiting for what the next COVID wave is going to look like this winter. So for sure, it's hard to tell if this is an early peak of RSV or just sort of on the way towards a peak in the winter.
Now she's back to keeping us up at night.
With the worst behind him, Sebastian wants other parents to stay vigilant about their kids' health.
Just really being on top of it and not ignoring the smallest symptoms, I think, was really the important takeaway here.
Stephanie Susskind, WPTV News Channel 5.
Now, Dr. De Silva says it can be hard to tell the difference between RSV, the flu, and other viruses at first, but there's a simple swab test that can confirm an RSV diagnosis. He says the best way to stay healthy is washing hands frequently, staying apart from others who are sick, and getting that flu shot.